November is Lung Cancer Awareness Month, and we're going to learn more about that kind of cancer, screenings, and treatments. Joining us today, Dr. Michael Bishop. He's with Mercy Health St. Rita's, and thanks for joining us today.
Absolutely, my pleasure.
So we hear lung cancer. What are things that we need to know that you think most likely we don't always know when it comes to this kind of cancer?
Well, one of the things I think that people don't realize is that when lung cancer is found early in the disease course, it is very curable. However, unfortunately, many patients wait too long until they start to develop significant symptoms to present for appropriate management of their cancer. And unfortunately, at that time, the chances of a cure are diminished or reduced. That's why it's important for patients who qualify for screening that they be screened adequately and appropriately in a timely manner.
Okay, first, let's start then with the signs. What kind of symptoms and signs should we start to look for to know, okay, we need to get that screening?
Sure. Well, for the screening, the criteria for that is for patients who've been smoking for a number of years, 20-pack years or more, patients who are current smokers or former smokers within the past 15 years, and patients between the ages of 50 and 80 years old. Those patients qualify for low-dose CT screening, which is a screening tool that we use to identify early lung cancers. For patients who may have advanced lung cancer, the symptoms of that disease would present as shortness of breath or cough that's uncommon for the patient, or hemoptysis, or coughing up speckled mucus of blood, or coughing up blood. Chest pain or other discomfort in the chest are signs of issues that may be related to lung cancer.
Obviously, you talked about smokers, that is one of the indicators. So obviously smoking is the top reason why people get lung cancer, or are there other issues that also bring lung cancer around?
I would say tobacco smoking is more than likely the leading cause of many lung cancers. We see that very often, and it is very much associated with the development of lung cancers. There are different forms of lung cancer. Small cell lung cancer is almost 100% related to tobacco smoking, and non-small cell lung cancer does have some genetic features for some patients who aren't smokers, but again, the vast majority of those patients are tobacco users.
Okay, so the one thing you could do to help yourself with this is to stop smoking, and we know that's difficult, but if they can, that would be the best thing to do right now.
Absolutely. Cessation of smoking and quitting the use of tobacco products would dramatically reduce the incidence of lung cancers as a whole. At Mercy St. Rita's, we do have a smoking cessation program that we offer our patients as well.
Mm-hmm. So it's good that we have these screenings and we can take it. So you said that if you catch it early, you know, there's a good cure rate. So we've got treatments at least. So that's why it's important to be aware of what's happening.
Absolutely.
Besides the treatments, I mean, do we have, is it surgery? Is it chemo? What kind of treatments are there available?
Sure. So for early stage disease, meaning there's a lung nodule essentially, and there's no local spread of disease, surgical resection still remains the standard of care. For those patients that do not qualify for surgery, there are radiation treatment options that we can utilize to cure early stage disease. For patients who unfortunately have locally advanced disease that is spread to the lymph nodes of the chest, that typically requires chemotherapy and radiation therapy for cure.
All right, very good. So if you fall in the category for a screening, do you need to go to your doctor first to get that appointment? How can you get into the list for that screening?
Sure. I think that would be a good discussion to have with your primary care physician to see if you qualify for screening, and if so, that would be a good avenue to get that set up.
All right. Well, thank you, Dr. Bishop, for raising awareness about lung cancer.
Absolutely. Thank you.
All right, don't go away. New Edition continues in a moment.